COVID is the great revealer. The mass death in long-term care, only a symptom of a sector long neglected. Why did it take a pandemic for us to notice, to care? And will it be enough to force change?
We as a society are failing older people, but it also means that, we're losing parents and grandparents to a system in Canada in an inexcusable state.
Laura Tamblin-Watts runs CanAge, a seniors advocacy organization.
The only good thing I hope that will come out of this pandemic is for us as a country to really understand that the long-term care system in Canada is broken.
Nursing homes are locked up tight now, but 2 years ago, CBC Marketplace went undercover inside long-term care, inside a home that today is struggling with a deadly outbreak.
I don't have 5 minutes. I don't even have 2 minutes.
Yeah. Never enough staffing in any long term.
No.
Sometimes they look at it as a conveyor belt.
Back then, seeing the impact of short staffing firsthand.
Oh, you have to go to the bathroom?
Yeah.
Okay, I'll let them know, okay?
Desperate residents waiting to use the toilet.
Sorry, he needs to use the washroom.
Still waiting.
Do you know if there's anyone that could take to the washroom?
Staff racing from room to room.
Help me.
Okay, so she can't go. But she's been waiting to use the washroom for like an hour.
By one estimate, Ontario staff were only getting 6 minutes to get each frail resident out of bed, dressed, and down for breakfast.
How can the send it away? Really? We don't want it that way, but that's the way you have to do it.
Minister Elliott, I'm David with CBC.
Such short staffing that we raised the long-standing issue with what was then Ontario's brand new health minister.
How do you address the concerns that these frontline workers have?
We take their concerns very seriously.
Now that same government is planning a review of the entire system.
Many of these issues have been decades in the making, and this sector was neglected for decades.
Back then, healthcare workers were sounding the alarm and demanding not just more staff, but a legal requirement for a minimum staff-to-resident ratio.
That's a huge, difference, right? But we should do everything for these people, not that you just be depressed and sitting in the office and...
This hidden camera captures care workers urging a visiting government inspector to do something out. But she points out the law does not require a ratio, a minimum number of staff to residents, similar to how daycares and schools operate. And so, there's nothing she can do.
Yes, they were fighting for that. But until we can't tell them how
In long-term care, people are very surprised to find out there is no actual minimum number of sort of staff to residents. And particularly, they're shocked to find out that it may mean that you actually would have, in some cases, one personal support worker to 20 or 30 residents at a time.
In Quebec, staff shortages meant some residents died not of COVID, but of dehydration and starvation, because staff just couldn't get to them. Homes themselves are a problem too. The architecture can hamper infection control. Rooms often shared, bathrooms too, sometimes 4 or more people, separated by little more than a curtain.
This is one of the reasons that so many people got sick and died in long-term care. They simply were not able to be socially distant. Beds are 2 feet apart. You've got communal washrooms. You had communal dining, communal activities. Everything in care homes is communal.
For 20 years, Karen Henderson has warned of the crisis in long-term care. 200,000 beds short nationwide. She says now is the time to build new and build private rooms, so infections are less likely to spread.
So that's where a lot of the money should go. But I also think that there's a tremendous opportunity in retrofitting the older buildings that we have. We have to do better for our long-term care. We've got to do better for our older Canadians. And we're not doing it.
The question for Karen is whether the trauma of the last 2 months will be remembered, whether changes made in emergency will stick.
And my fear, David, is that we have made some changes as a result of COVID-19. There's been some wage increases. There's been some changes in working conditions for PSWs. But I fear that when everything settles down, that we're going to somehow slip back to the way we were unless there is enough of a public outcry to say, we've seen the horrors and we've had enough. And as far as I'm concerned, I never want to end up in a long-term care facility, at least not the way they are now, and I will do everything in my power not to end up in one.
As horrible as the pandemic has been inside long-term care, the legacy of all the death may finally be change. David Common, CBC News, Toronto.